Welcome to Policy Matters, Season 4, Episode 1. Policy Matters is a video chat series between Teri Talan of the McCormick Center and guest thought leaders in early childhood policy. This year, our focus is on racial equity, an important topic in early childhood education. It is being discussed at policy tables, promoted by philanthropy, and, in some exemplary programs, put into practice by leaders and teachers. What is racial equity? How does it differ from multicultural and inclusive early childhood services? Why is it important to call out racial equity in policy? How can you take action at the state, community, and program level? Our guest for this episode is Dr. Aisha Ray, Distinguished Fellow at Build Initiative.
Welcome, Aisha. It is such a pleasure to be meeting with you today for our policy chat on this really important topic of racial equity. I'm thrilled that you agreed to meet with us. You've been doing some really important work with the state in Illinois with the Early Learning Council Executive Committee, of which I'm a part, and it's been a real pleasure. I'd like to start by just asking if you could explain your role with the Build Initiative around helping states tackle the thorny issue around policies and racial equity.
Certainly. Well, thank you for inviting me to the policy talk. I'm happy to do this. I think the Build Initiative's work really is helping states across the country focus on developing and sustaining coherent early childhood policies across early childhood systems, to get systems to work more effectively with one another, to get early learning to work more effectively with mental health system, agencies and entities within states and with health agencies and with child welfare, so that we're really developing a system that benefits all children, but particularly is targeted at improving the lives and outcomes for kids who are really furthest from opportunity. So that's the core of Bill's work. A lot of that work, particularly the part about those children furthest from opportunity, is really based on an equity strategy, advancing an equity strategy, and particularly focusing on racial and social class issues in terms of child outcomes. One of the things that drives that equity work is a focus on using data within states to really lift up and for all of us to look at where the disparities really lie. Mm-hmm. In Illinois, with the Early Learning Council, that work has focused on a number of key things. First of all, I'll say Illinois has had a focus on trying to ameliorate the problems of poverty in the state for its neediest children. What the racial equity focus brings is both a focus on race and its intersection with class. If you take a strategy that's simply focused on class, you basically don't see the real impact that racism has had on child outcomes.
So, Aisha, I know sometimes people are confused about some of the terminology, and the terminology about equity and equality. Can you help us understand how you see those terms working together or not?
Sure. So racial equity or or gender equity, any of these equity strategies are really it's both a noun and a verb. It's something a goal we're trying to seek, and a process we use to get there. So with equity as a goal, we're focused on the fact that when we look at the data on child outcomes, we see that children of color and children in rural communities, including white children in Illinois, are really disproportionately affected by issues of poverty, lack of resources often in their communities that we generally associate with good child welfare. And what we try to do in terms of the goal is to change that, to make equity no longer an issue in our work. When we think of equity as a verb, we're using equity strategies to try to address this, looking at data, including those most affected by inequality in our conversations and planning and design of project resources and policies. When we use these terms, when we use the term equity, we're really trying to get to the point where the barriers are reduced, that people furthest from opportunity receive everything they need, and that we're also trying to ensure that policies and programs and procedures we develop within state systems are fair and just, and that groups historically disadvantaged are no longer disadvantaged by the policies and programs we develop. To the equity-equality difference, which is an important thing for people to understand, when we focus on equality, which is a foundational idea in the United States, that everyone is equal, one person, one vote, for example. When we think about equality, it is a goal we seek, certainly. It's a universal goal. Everyone will be treated fairly and equally. The reality, though, is that that is not the case. We know that children, when born, or children even in utero, already some have greater advantages than other children. Some have mothers who have access to high-quality nutrition, other children do not. Some children have mothers and families who have access to high-quality health care. Other children in utero do not. That's a basic inequality. In order to address that inequality, we can't use an equality approach. We can't make sure that everyone gets the same amount of prenatal care. We want to make sure that those who have the greatest need, not only for prenatal care, but for possibly safe housing, good nutrition, mental health services, that those individuals also get those supports if they need them. So equity is a strategy to try to correct the imbalance between some communities, some individuals, and other communities and other individuals that we know are present because of our long history of really, as a country, of really treating groups differently based on issues like gender, race, and social class.
I've often thought it was kind of strange how we in Illinois and maybe in other states have programs called preschool for all, but they're really not for all. We have focused in Illinois with preschool for all on those who are furthest from opportunities. And that has always sort of felt like a little bit of a misnomer. But from the perspective of trying to get everybody to the same outcomes and having equal high quality early learning experiences, it makes sense in terms of what you're have just described.
Well, I think right, and I think one of the ways to think about equity strategies versus what we want for universally for every child is that we have universal goals for all children. High quality care, great health care, safe communities, stable families. We want that for every child. But we recognize that we have to have targeted strategies to really address the inequalities that exist in order for us to get to equality. We have to use equity strategies. So for instance, if we take the example of high quality early childhood care and education, we know that a significant number of children in Illinois, particularly poor children and children of color, particularly those in poverty, do not have less access to high quality care and education than children whose families can actually buy them high quality early care and education. In order to address that universal goal that everyone have that, we have to look at how to really drive resources to those children who have the least access to that care and make sure that they get it.
And I think what's different is thinking about policy. Like, how is it that our policies can actually influence those outcomes by applying an equity lens? And And what just comes to my mind is I was a center director once upon a moon ago. And when that was true, we used to always talk about how individualizing children, that everyone wasn't treated the same, that we made a special plan based on the need of a child, of what they needed. So the example that comes to my mind was we had a child who had sensory integration challenges, and the specialists who came to support our staff said or suggested, let's let him chew gum, that would really help. Well, of course, we had children who would say, I want to chew gum. Why does he get to chew gum? And we would say, well, he has that need, and it's, we're making a special plan for him. We'll make a special plan for you when you have a need, and along those lines. And somehow we do that unconsciously, and we do that with our own children, right? Everybody isn't exactly the same. They get what they need. But to translate that to policy is sometimes harder for people to swallow. And I think that, that is one of the challenges that is so important in the work that you're supporting with us in Illinois.
Well, it's important, I think, for leadership to be able to both articulate why this is necessary to a broad audience, because there is, I think, in the United States, and our current politics reflects this, a kind of sense of grievance that people have that someone is going to get more than they get. On the other hand, we have had a long history of recognizing that children in poverty, as a country, the children in poverty deserve supports that perhaps their families cannot provide, that we as a society have that obligation. So I think a lot of this, of the public acceptance of the idea that poor children in poverty and children who are disadvantaged by the circumstances that their families or communities find themselves in should not be punished because of those realities. We don't withhold support to young children who need mental health services because their parents can't afford it, or we should not do that. And part of our leadership role at state leadership from the governor on down is to really help all of us understand our mutual obligations to one another as a society, and that an equity strategy is a way to really address the inequalities so that all children really can thrive and survive. It's a benefit for the entire state and nation, basically, to have that kind of approach and that kind of leadership that can make that case.
Well, thank you so much, Aisha. This has been really a wonderful opportunity to tease out this some of the issues around applying a racial equity lens to policy at the state level. Thank you.
My pleasure.